What if one of the simplest habits in your daily routine, something you do without thinking, could significantly influence your blood sugar, your energy levels, and even your risk of developing diabetes? I'm talking about how you drink water. Now, most people believe water is just water you drink when you're thirsty, and that's about it. But what the research increasingly shows is that hydration timing, quantity, and even the way you drink water can influence your metabolism, your insulin response, and how your body regulates blood sugar. This becomes especially important as we age. After the age of 60, several metabolic changes begin to happen quietly inside the body. The hormone systems that regulate glucose, insulin, kidney function, and hydration signals become less efficient. The sensation of thirst often weakens, kidney filtration changes, and the body becomes more sensitive to blood sugar fluctuations. Here's what's really going on inside your body. Your bloodstream is essentially a transport highway carrying glucose, insulin, nutrients, and hormones to every cell. But when hydration is poor, even mildly poor, the blood becomes more concentrated. Imagine syrup versus water. When blood becomes more concentrated, glucose levels in the bloodstream appear higher. Insulin signaling becomes less efficient, and the pancreas has to work harder to regulate sugar. Over time, this can contribute to insulin resistance, which is one of the root drivers of type 2 diabetes. Now, here's the surprising part. Most seniors who struggle with elevated blood sugar are not actually drinking water in the most metabolically supportive way. Some drink too little, some drink large amounts at the wrong time, others unintentionally disrupt blood sugar regulation by pairing water with certain habits that spike insulin. But when hydration is done strategically, it can support the body's natural ability to regulate glucose, improve kidney filtration, and even reduce the workload on the pancreas. And this is exactly the type of metabolic support that researchers studying longevity and nutrition, including experts like William Li, emphasize when discussing lifestyle strategies for preventing chronic disease. In today's talk, we're going to break this down in a very practical way. You'll learn 6 science-backed insights about hydration and blood sugar regulation, specifically for adults over 60. We'll discuss the most common hydration mistake that quietly raises blood sugar, why the timing of water intake matters more than most people realize, how dehydration can stress your kidneys and insulin system, the specific drinking pattern that helps stabilize glucose levels, and simple daily habits that support metabolic health without medication. These strategies are not complicated. They're small adjustments, but they can make a meaningful difference in how your body manages energy and blood sugar over time. Because sometimes the most powerful health interventions are not dramatic lifestyle overhauls. Sometimes they start with something as simple as a glass of water, used the right way. And if you find this type of science-based health guidance helpful, consider subscribing. I share content regularly to help people protect their metabolism, improve energy, and support long-term health naturally. Let's start with the first and most overlooked concept, because many people assume blood sugar is controlled only by food, especially carbohydrates. But here's what's really going on inside your body. Hydration plays a direct role in blood sugar regulation, and even mild dehydration can quietly push glucose levels higher. Let me explain this with a simple analogy. Imagine your bloodstream as a river. In that river, many things are flowing: oxygen, nutrients, hormones, electrolytes, and glucose. Now picture what happens if the water level in that river starts to drop. The river becomes more concentrated. Everything inside it becomes thicker and denser. The same thing happens in your bloodstream when you're dehydrated. When the body lacks enough water, blood plasma volume decreases. As a result, the glucose circulating in your blood becomes more concentrated, which leads to higher measured blood sugar levels. So even if you haven't eaten anything sugary, dehydration alone can cause glucose readings to rise. Research has shown that people who drink less water tend to have a higher risk of developing type 2 diabetes over time. One large observational study published in Diabetes Care found that individuals with lower daily water intake had a higher incidence of elevated blood sugar and metabolic dysfunction. Why? Because dehydration triggers a cascade of hormonal responses designed to protect the body from fluid loss. One of the key hormones involved in this process is vasopressin, sometimes called antidiuretic hormone. When your body senses dehydration, vasopressin levels increase to conserve water. But here's the fascinating part. Chronically elevated vasopressin levels have been associated with higher glucose production by the liver, increased stress signaling, and impaired insulin sensitivity. In other words, dehydration may indirectly push the body toward metabolic imbalance. This effect becomes even more significant for adults over 60. As we age, the body's thirst mechanism becomes less sensitive. Many seniors simply don't feel thirsty even when the body needs water. At the same time, kidney function naturally declines with age, making hydration even more important for maintaining metabolic stability. So what can you do about this? The solution is not complicated, but it does require intention. Instead of waiting until you feel thirsty, aim for consistent hydration throughout the day. Start with a glass of water within the first 30 minutes after waking. Think of it as turning the metabolic engine on. Overnight, your body loses water through breathing and sweat. Morning hydration helps restore plasma volume and support circulation before the day begins. Another helpful strategy is drinking a glass of water about 20 to 30 minutes before meals. This not only supports digestion, but may also help reduce blood sugar spikes after eating. Because when the body is well hydrated, circulation improves, nutrient delivery becomes more efficient, and metabolic signaling becomes more balanced. But there's an important nuance here. The goal isn't simply drinking more water. It's drinking water in the right rhythm throughout the day. Small, consistent intake supports metabolic balance far better than consuming large volumes all at once. And this brings us to the next insight. Because hydration isn't just about blood sugar concentration, it also affects how your kidneys process glucose and regulate metabolic waste. And that connection is one of the most powerful and least discussed factors in blood sugar control. If this is helpful so far, consider subscribing to the channel. I share practical, science-based strategies like this to help people protect their metabolism, improve energy, and age healthier naturally. Now let's continue with the next piece of the puzzle: how your kidneys influence blood sugar regulation more than most people realize. Now let's go one level deeper, because hydration doesn't just dilute blood sugar. It directly influences how your kidneys regulate glucose inside your body. Here's what's really going on. Your kidneys are not just filters that remove waste. They are also powerful metabolic regulators. Every single day, your kidneys filter nearly 180 liters of blood plasma. Inside that fluid is glucose, the sugar circulating in your bloodstream. Normally, your kidneys reabsorb most of that glucose and return it to the bloodstream so the body can use it for energy. But when blood sugar rises too high, the kidneys begin to remove some glucose through urine. This process acts like a pressure release valve for excess sugar. Let me explain this with a simple analogy. Imagine your bloodstream is like a water tank connected to a drainage system. The kidneys are the drainage valves. If the tank starts to fill with too much sugar, the kidneys open the valve and release some of that excess through urine. But this entire system depends on one critical factor: adequate hydration. If the body is dehydrated, the kidneys receive a signal to conserve fluid. That means they produce less urine, and when urine output drops, the body becomes less efficient at eliminating excess glucose. In other words, dehydration can reduce the kidney's ability to flush out extra sugar. Over time, this may contribute to chronically elevated blood glucose levels. Researchers have even found that higher hydration levels are associated with lower fasting glucose and better metabolic health. But there's another layer to this. Dehydration increases levels of the hormone cortisol, the body's primary stress hormone. Cortisol has a powerful effect on blood sugar. One of its main jobs is to signal the liver to release stored glucose during times of stress. This is helpful during emergencies. But if cortisol stays elevated, which can happen during chronic dehydration, the liver may continuously release glucose into the bloodstream. And that can push blood sugar levels higher, even when you haven't eaten. So the body becomes trapped in a metabolic loop. Dehydration raises cortisol. Cortisol triggers glucose release. Blood sugar rises. The pancreas must produce more insulin to compensate. Over time, this cycle can contribute to insulin resistance and increase the risk of type 2 diabetes. And again, this risk becomes even more relevant with aging. After the age of 60, kidney efficiency naturally declines. The filtration system becomes less responsive, which means the body depends even more on proper hydration to maintain balance. So what's the practical takeaway? Instead of thinking about water as something you drink occasionally, think of it as a metabolic regulator. Here's a simple hydration rhythm that supports kidney function and glucose balance. Drink 1 glass of water shortly after waking. Drink 1 glass 20 minutes before each meal. Sip water steadily throughout the afternoon. Reduce large amounts late at night to avoid sleep disruption. This pattern supports circulation, kidney filtration, and glucose regulation, and it prevents the body from slipping into the stress response triggered by dehydration. But there's another factor that many people overlook. Not just how much water you drink, but when you drink it during the day, can significantly influence blood sugar stability because the body's hormonal system follows a daily rhythm, and hydration timing can either support that rhythm or disrupt it. In the next section, we'll explore something surprising: why morning hydration may be one of the most powerful metabolic habits seniors can adopt for blood sugar control, and how a simple change in your first hour of the day can influence glucose levels for the next 12 to 16 hours. Now let's talk about something that may seem simple, but has profound effects on metabolic health: how you start your morning with water. Because the first hour after waking is when your body undergoes one of the most important hormonal transitions of the entire day. Here's what's really going on inside your body. While you sleep, your body naturally loses fluids through breathing, skin evaporation, and cellular repair processes. By morning, most people wake up mildly dehydrated. At the same time, your body releases a hormone called cortisol. Now, cortisol often gets a bad reputation, but in the morning, it actually serves a very useful purpose. It helps wake you up, increase alertness, and mobilize energy by gently raising blood sugar, so your brain and muscles have fuel to start the day. This natural rise is known as the dawn phenomenon, and it occurs in nearly everyone. But it can be more pronounced in older adults and people with insulin resistance. Here's the key point. If the body is dehydrated during this cortisol surge, blood becomes slightly more concentrated, which means glucose levels appear higher. Let me explain this with a simple analogy. Imagine adding a spoonful of sugar to 2 glasses of liquid. In a full glass of water, the sugar concentration is moderate, but in a half-empty glass, the exact same amount of sugar becomes much more concentrated. The same thing happens in your bloodstream. When hydration levels are low, glucose becomes more concentrated in the blood, which can push fasting blood sugar readings higher, and even if your diet hasn't changed. This is one reason doctors often see elevated morning glucose numbers in people who are simply not drinking enough water early in the day. But the benefits of morning hydration go even deeper. When you drink water shortly after waking, it helps stimulate the kidneys, activate circulation, and gently support the release of metabolic hormones that regulate energy and glucose. Research published in Metabolic Health Studies shows that early day hydration supports insulin sensitivity, meaning your cells respond more efficiently to insulin signals. And when cells respond better to insulin, they absorb glucose from the bloodstream more effectively. That means lower blood sugar levels with less stress on the pancreas. Now, here's a practical protocol that works extremely well for many older adults. Think of it as the morning metabolic reset. Step 1. Within 10 to 15 minutes of waking, drink 1 glass of water in about 250 to 350 milliliters. Room temperature or slightly warm water tends to be easier on digestion. Step 2, wait 15 to 20 minutes before drinking coffee or tea. This allows the body to rehydrate and activate circulation before caffeine stimulates the nervous system. Step 3, if you want to go one step further, add a small pinch of mineral salt or a squeeze of lemon to the water. This helps replenish electrolytes that may have been lost overnight and supports cellular hydration. Now, a quick reminder. Hydration doesn't need to be extreme. In fact, drinking excessive water all at once can actually dilute electrolytes and stress the kidneys. The goal is consistent, steady hydration throughout the day, beginning with that first glass in the morning. And if this is helpful so far, consider subscribing, because every week we explore science-based habits that help support metabolism, healthy aging, and long-term vitality. But there's another factor that many people don't realize plays a role in blood sugar regulation, and it has to do with how water interacts with digestion and insulin response during meals. Now let's move deeper into a powerful strategy that most people completely overlook: drinking water before meals and how it influences blood sugar control. Because this small habit can significantly change how your body handles glucose. Here's what's really going on inside your body. When you eat a meal, carbohydrates break down into glucose, which then enters the bloodstream. In response, the pancreas releases the hormone insulin, whose job is to move that glucose from the blood into your cells where it can be used for energy. But as people age, something important often changes. Cells gradually become less sensitive to insulin signals, a process known as insulin resistance. When this happens, glucose stays in the bloodstream longer, and the pancreas has to produce more insulin to compensate. Over time, this metabolic strain can increase the risk of developing type 2 diabetes. Now, here's where hydration enters the picture. Water consumed before meals can influence digestion, satiety signals, and glucose absorption in ways that support healthier metabolic responses. Let me explain this with a simple analogy. Imagine pouring syrup onto a dry sponge versus a sponge that is already slightly damp. The dry sponge absorbs the syrup quickly and unevenly, but the damp sponge distributes the liquid more gradually. In the same way, when your digestive system is well hydrated before eating, the breakdown and absorption of nutrients tends to happen more steadily, which helps prevent rapid blood sugar spikes. Research published in metabolic and obesity journals has found that people who drink about 400-500 milliliters of water roughly 30 minutes before meals tend to experience improved satiety and reduced calorie intake. But there's another important metabolic benefit. Hydration helps maintain optimal blood volume and circulation, allowing glucose and insulin to move more efficiently throughout the body. This supports better cellular glucose uptake, especially in muscle tissue. And muscle tissue is one of the largest glucose sinks in the human body. Now let's talk about a practical protocol. Think of this as the pre-meal hydration strategy. About 20 to 30 minutes before your main meals, drink 1 glass of water, roughly 300 to 400 milliliters. This timing matters. Drinking water right before or during meals can sometimes dilute stomach acid and digestive enzymes, which may slightly impair digestion for some individuals. But drinking water 20-30 minutes beforehand allows the body to hydrate tissues and prepare digestion without interfering with stomach chemistry. For seniors, this strategy can be particularly beneficial because thirst perception naturally declines with age. In other words, older adults often become mildly dehydrated without realizing it. And mild dehydration can contribute to elevated blood sugar levels, fatigue, and slower metabolism. Another benefit of drinking water before meals is appetite regulation. Hydration activates stretch receptors in the stomach and signals the brain that the body is receiving nourishment. This can help reduce overeating, which indirectly supports glucose stability and weight management. And maintaining a healthy weight is one of the strongest protective factors against metabolic diseases. Now, one more important detail: plain water works perfectly well. But if you want to enhance metabolic benefits slightly, you can occasionally add a splash of lemon or a few slices of cucumber. These add trace phytonutrients and flavor without adding sugar or calories. The key idea is simple. Consistent hydration before meals helps your metabolism stay balanced, supports insulin efficiency, and prevents unnecessary blood sugar spikes. And small daily habits like this, repeated over months and years, can dramatically change long-term metabolic outcomes. But there's another hydration mistake many people make, especially in the evening. And surprisingly, this mistake can actually raise morning blood sugar levels the next day. Let's now talk about a hydration mistake that many people make in the evening. And surprisingly, it can influence your blood sugar the next morning. This mistake is either drinking too much water right before bed or not drinking enough water earlier in the day. Both patterns can disrupt your body's metabolic rhythm. Here's what's really going on inside your body. Your metabolism operates on a 24-hour biological clock known as the circadian rhythm. This internal timing system controls when hormones rise and fall throughout the day. During the night, your body releases a hormone called melatonin, which helps initiate sleep and signals the body that it's time for repair and recovery. At the same time, another hormone called vasopressin increases. Vasopressin helps the kidneys concentrate urine, meaning you produce less urine while sleeping. This is one of the reasons healthy sleep normally lasts several hours without waking up to use the bathroom. But when hydration patterns are inconsistent during the day, the body often tries to compensate in the evening. People who haven't drunk enough water earlier suddenly drink several glasses at night. That overwhelms the kidneys, and instead of sleeping deeply, they wake up multiple times to urinate. Now you might be wondering, what does this have to do with blood sugar? The connection is sleep disruption. When sleep is fragmented, the body releases more cortisol, the primary stress hormone. Cortisol raises blood glucose levels because it signals the liver to release stored sugar into the bloodstream. This mechanism is useful in emergencies, but harmful when it happens every night. Research in sleep medicine has repeatedly shown that poor sleep increases insulin resistance and raises fasting glucose levels the next morning. So something as simple as frequent nighttime awakenings can gradually worsen metabolic health. Let me explain this with a simple analogy. Think of your metabolism like a factory that runs a maintenance cycle overnight. If the factory keeps getting interrupted, lights on, machines stopping and starting, the repair process never finishes properly. The next day, the system runs less efficiently. Your body works in a very similar way. Deep, uninterrupted sleep supports glucose regulation, hormone balance, and nervous system repair. That's why hydration timing matters just as much as hydration quantity. Here's a practical evening hydration protocol you can use. First, aim to drink most of your daily water earlier in the day, especially between morning and late afternoon. Second, gradually reduce fluid intake about 2 hours before bedtime. This allows the kidneys to process fluids before sleep begins. Third, if you feel thirsty at night, take small sips rather than large glasses of water. This keeps the body comfortable without overwhelming the bladder. Another helpful habit is including electrolyte-rich foods during the day, such as leafy greens, avocados, and lightly salted whole foods. Electrolytes help your body retain hydration inside cells rather than rapidly excreting it through urine, and that helps maintain stable circulation overnight. The goal isn't to restrict water. The goal is to hydrate strategically, drink consistently throughout the day, taper fluids slightly in the evening, and protect your sleep. Because when sleep improves, insulin sensitivity improves. When insulin sensitivity improves, blood sugar stabilizes. And when blood sugar stabilizes, the risk of metabolic disease begins to decline. In the next section, we'll explore something even more surprising. There are specific minerals in water that can directly support blood sugar regulation, and many people are unknowingly deficient in them. Now let's explore something most people never think about when they drink water. Not all water supports metabolic health the same way. Because water isn't just H2O, it's also a delivery system for minerals that influence blood sugar regulation. And when those minerals are missing, hydration alone may not properly support metabolism. Here's what's really going on inside your body. Two minerals play a major role in blood sugar control, magnesium and chromium. Both are essential for helping insulin work efficiently, and this is especially important for older adults. Let me explain this with a simple analogy. Think of insulin like a key that unlocks the door of your cells so glucose can enter and be used for energy. But the lock on that door requires specific minerals to function smoothly. Magnesium and chromium help stabilize the insulin receptor, allowing the key to turn properly. Without them, the key struggles to open the door. That's when glucose begins accumulating in the bloodstream, which is the early pathway toward type 2 diabetes. Now, here's the surprising part. Many older adults are chronically low in magnesium. Studies published in the journal Diabetes Care show that low magnesium levels are strongly associated with increased insulin resistance and higher diabetes risk. And hydration plays a role here. Certain natural mineral waters contain small amounts of magnesium that can contribute to daily intake. But even if your drinking water is low in minerals, there are simple ways to restore this balance. Let's talk about practical solutions. First, focus on magnesium-rich foods during the day. Some of the best options include leafy greens like spinach and Swiss chard, pumpkin seeds, almonds, avocados, dark chocolate with high cocoa content. These foods not only provide magnesium, but also support metabolic health through fiber and healthy fats. Second, some people benefit from magnesium supplementation, particularly forms such as magnesium glycinate or magnesium citrate, which are commonly used for absorption and metabolic support. Magnesium taken in the evening may also support muscle relaxation and sleep quality, another important factor in blood sugar control. Third, avoid overconsumption of beverages that deplete magnesium, such as excess caffeine and sugary soft drinks. Both can increase mineral loss through the kidneys. And here's something many seniors don't realize. Chronic dehydration combined with low mineral intake can slowly stress the pancreas, the organ responsible for producing insulin. Over time, this metabolic stress contributes to rising blood sugar levels. But the good news is that simple daily habits can reverse that trend. Hydrate consistently, eat mineral-rich foods, protect sleep, and support insulin sensitivity naturally. If this is helpful so far, consider subscribing. I share evidence-based strategies like this regularly to help people take control of their metabolic health. In the next section, we'll talk about a hydration mistake that often surprises people. It involves drinking water too quickly, and it can actually affect blood sugar, digestion, and circulation. Now let's talk about a hydration mistake that many people make, especially in the morning, without realizing it can influence blood sugar control. It's not about how much water you drink, it's about how quickly you drink it. Here's what's really going on inside your body. Many people wake up slightly dehydrated after a full night of sleep. So the first thing they do is drink a large glass of water all at once. It feels healthy, it feels refreshing. But when large amounts of water are consumed too quickly, the body responds in a way that may not be ideal for metabolic balance. Let me explain this with a simple analogy. Think of your bloodstream like a carefully balanced river. Electrolytes, hormones, glucose, and minerals flow through it in precise concentrations. When you suddenly pour a large amount of water into that river, the body has to quickly restore balance. Your kidneys respond by rapidly filtering out the excess fluid. This